This JTV News Update is brought to you by Eureka Medical Clinic, Nagico Insurance, and Flow. Premier and Minister of Finance, Dr. the Honorable D. Orlando Smith, accompanied by several ministers of government, commenced their interaction with members of the community across the territory on January 24, 2017. The meeting, designed for the country's government leaders to hear from residents on the recently developed draft proposed recovery development plan. While there was not a packed audience at the first meeting held in District 4 at Altius Catliff Primary School, those who turned out were very candid in sharing their thoughts. Mr. Gerard Ferrara, QC, who lauded the government for recognizing and for putting together such a document, said that its generalities heavily outweighs specifics.
I think that in terms of the process itself, we have made a fundamental mistake at the very beginning, because when you look at the coordinating committee and when you look at the task force, there is not one single representation from the private sector. That is wrong. And in my respectful view, there is still time to correct it, and it ought to be corrected. Because the essence of this situation with which we are presented is that, as I told some reporters from JTV outside Scotiabank, we are all in this together. We are all in the same ship. And anytime we are talking and speaking to a recovery and development plan, it must be something which now is inclusive from the very beginning, so that all the necessary participation and input can be had, and the plan can ultimately be what it ought to be. And what ought the plan to be? The plan ought not to be a 5-year plan, because 5-year plan, in my respectful view, is that we are still dealing with recovery. We are not really much, if at all, into development. We have a golden opportunity here to develop a plan that will take the country forward for 10, 15 years. And that is the kind of plan which we ought to focus on, and that is the kind of plan which we develop. And I commend the group for having not just pitched it as a recovery plan, but also pitched it as a development plan. And speaking to that, we must, in the starting point of all of this, is to have a vision, a clear vision as to what we collectively would like the country to look like in the next 10 or 15 years. Not 5 years, 10 or 15 years. Because it is important that we all buy in, not just to the process, but ultimately to the product of the process. And we all buy into that recovery and development plan based on a vision as to what the country ought to look like, or what we would like the country to look like in 10 to 15 years.
There were other concerns voiced by several persons.
Another thing I'd like to say is that Britain is in charge of this country. England is in charge of this country. We're not democracy. We're not an independent country. And they're acting as though we can't go to Britain. I'm not saying it's always right, but I'm saying that we are not an independent country. And we got to respect the leadership, we respect those in authority.
But the experiences that happen now with labor and immigration are counterproductive to that. Now, please, I do not want anybody to think for 1 minute that I am critical of any of the people who are working in the labor and immigration departments. I have been in both departments multiple times over the last several months, and what they have done is nothing short of miraculous. But it would not have been difficult to foresee that there needed to be some kind of change, some kind of temporary protocol in place to help the staff deal with what was happening. When you have over 200 people laid off in 1 week, but the positions are still exactly the same with regard transfer of work permits, how can you expect staff working in almost non-existent offices to handle that well?
There's also another underlying feature which could be put in place. There are a lot of homes which in fact have been destroyed that didn't have insurance coverage. In terms of getting value for money, in terms of being able to demand coverage at a lower price per unit, if government also look at the prospect of providing some framework whereby private home ownership can be covered under a captive which also covers government properties. Okay, that is fundamental.
I know I heard Mr. Penn talk about, really mention primary, secondary, and tertiary health care, but I don't see it going into depth in terms of that. I don't see anybody representing health services on this team, any other teams at all. If you know, all the clinics on the outer district that represent primary health care are very vulnerable to weather situations. We lost the one in Long Look. We had to go back to the one in East End that was condemned, right? And we have pushed for space there. The one in Capoons there was lost. The one in Anegada stood firm, and I'll come back to that later. The one in Virgin Gorda basically was functioning. All right, the one in Just Van Dyke, we also lost that. The one in King Garden Bay, you know what happened to that one there. And the one in Bruce Bay, we also lost that. So these clinics in primary health care are 40 to 50 years old. They all need to be abandoned. They all need to start from the ground up.
On the other hand, there was the feeling that the format being used to garner the views of the masses is one that does not lend it to a wide cross-section of residents feeling comfortable to be candid.
I think if there was a sort of a village hall set up somewhere, I'm not quite sure where, I mean this structure is ideal, but somewhere similar in Road Town that could put desks for each district perhaps, desks for help desks, but also a catchment for ideas. People could come forward with ideas. I think people are intimidated in these kind of close quarter meetings to actually come forward with suggestions. But if there was more of a sort of a public hall that went on for a month or 2 months, or was a kind of a miniature government that on the street that people could come in and put their suggestions to, it might well help build a vision. It would also help build the national pride and the national identity, because we would all feel the ability to sort of contribute directly, but not in a sort of intimidating environment.
To finance its proposed plan, the government has said it will seek funding through various means. Government vowed to contribute $58.9 million to its recovery and is seeking $52.7 million from grants, $221.7 million from loans, $331.4 million from private NGOs' statutory sources, and $56.7 million from insurance. The community meetings will continue for another 2 to 3 weeks. With this JTV News Update, Kathy Richards.
Eureka, located in the British Virgin Islands. Come, discover Eureka Medical Clinic, which provides the most complete medical services in the Virgin Islands. Our state-of-the-art clinic offers the highest quality in specialty care, cardiology, gastroenterology, orthopedics, and spinal surgery. We also offer specialty care in obstetrics and gynecology, as well as dermatology. Eureka Medical Clinic offers diagnostic procedures such as x-rays, mammograms, CAT scans, and all forms of ultrasound exams. Now, for the first time in the BVI, Eureka offers MRI scanning too. With colonoscopy and gastroscopy, we check the intestines and stomach for polyps, colon cancer, and ulcers too. Located at Geneva Place in the heart of Road Town, Eureka Medical Clinic with Medicare Pharmacy and Labs offers you a comprehensive medical facility all under one roof. So for high-quality medical services and convenience, there's no need to look any further. Eureka! You found it.
When it comes to your health, being uninsured is never an option. Listen to some sound advice. Nagico's Nagicare is one of the best medical insurance plans your money can buy. We offer you solutions to medical coverage benefits tailor-made to your budget and preferences, so that the next time you visit a doctor, you can rest assured that we've got you covered. Visit our website, nagico.com, or contact a Nagico office or agent near you. Nagico Insurances. We've got you covered.